And hi, everyone. And thank you so much for joining this session. I think it really, such conferences are so important for all of us to just come together and discuss the broader narrative. Rosa, if I could just request you to share the slides and we'll get started.
Let me know if that's working.
Yeah. Okay. Yeah. So today's session is super close to all of our hearts here, and it is super important for all of us. We are coming here and we are speaking from our lived experience as young adults living with a chronic illness. And we firsthand know the mental health challenges that we go through along with our physical health challenges. It's the year of 2025, and I know there's a lot of changes that is happening in the youth mental health area. However, young adults with chronic illness, we are often overlooked in this narrative. We are often overlooked in treatment, in research, and in policy implementation. So just a trigger warning, our session does mention instances of mental health, chronic illnesses, and instances of suicidal ideation. At the end, we're also sharing resources if anybody is triggered by the session or they would like to seek help. So just a trigger warning for all of you. So here are a few of the mental health challenges that individuals living with a chronic illness face. These are not all of them. There's a lot more that we go through, but these are the common ones that you would see. Isolation, because living with a chronic illness is a very isolating experience because you feel as though nobody understands you. So you would rather just deal with this alone. And it takes a huge toll on your mental health. Fear of rejection, because as young adults, when you're diagnosed with something like a lifelong illness, you're not sure who's going to accept you. Are you going to make new friends or not? So there's always this fear of rejection, stigma, especially for chronic illnesses that are invisible or, for example, I have an invisible chronic illness and I'm often told that you don't look too sick. Maybe you're just seeking attention. So there's the stigma that is often attached with a lifelong illness, and there's always stigma attached with mental illness as well. So with the combination of the two of them, I think then that really takes a massive toll on us. Stress, I think it goes without saying, living with a lifelong physical condition can cause a lot of stress. Or small things, big things, anything can cause massive stress for us. Grief, because we can no longer live the life that we wanted to. We can no longer pursue the dreams that we wanted to. Even if we could, it takes a longer time. We don't recognize the person that we were before our chronic illness. So there's this grief of the person you had to let go of, grief of the person you could never be, grief of the life you could never have. But it goes without saying, depression, when you have to face isolation, when you have to face stigma, when you have to face fear of rejection, is a high chance that you will, individuals with chronic illness are often diagnosed with depression. I am diagnosed with depression and anxiety, and it's a day-to-day life for most of us living with a chronic illness. Trauma and health related PTSD. Very often health related trauma is neglected because I think even in the mental health space, the narrative is around childhood traumatic experiences or war veterans and things like that. But medical trauma is often overlooked, but it's a huge concern for individuals living with a chronic illness. There's trauma of hospitalization, trauma of having massive surgeries, trauma of having to sit through appointments, and trauma of being gaslit by your medical professionals. I'm not saying all the medical or mental medical professionals would gaslight you, but a lot of us have often been gaslit into thinking it's all in our head. We don't have any illness and we're just making things up. So all of that adds to the health related trauma. Anxiety, more specifically health anxiety, because we are always anxious about the symptoms. Even if we are doing good, even if we are in remission, one small flare up can just spiral us into this huge bout of anxiety because we can never be at peace. We never know when things will go bad again, and we're always waiting for the worst to happen. And trigger warning here again, suicidal ideation. Next slide. I'll talk a bit more about it on the next slide. So individuals living with a chronic illness, their odds of suicidal thoughts increase by 28% and plans to die by suicide by 134%. Having a chronic condition increases the odds of a suicide attempt by 363%. This is a massive statistics, and especially this month when we are talking about World Suicide Prevention Day coming on September 10th, and with the whole change, the narrative part, and globally with so many people dying of suicide daily, this is a cause for alarm. I think this is something which is very alarming in the chronic illness community. So the whole idea of today's session is to highlight the structural inclusion of chronically ill adults in into mental health care. Where are we excluded and why should we be included? And we're going to share perspectives that come from our lived experience, particularly from the low middle income countries and also from minority groups. So I would love to introduce our speakers today. Akhil, who is a patient advocate from Udupi, India. Alexis, a patient advocate from California, USA. Rosa, my fellow patient advocate from California, USA. And hi, I'm Malvika, a psychologist and patient advocate from Bangalore, India. But today I'm primarily going to speak from a patient perspective. So now I pass it to Alexis for her speaker session.
Thank you, Malvika, and thank you to everyone here in this webinar for joining us today. My name is Alexis, and I'm going to be talking a little bit about uncertainty and health anxiety for young adults with chronic illnesses and what that might look like day to day. So next slide. So one of the first things that I want to bring up is this concept of medical gaslighting, which is a phenomenon that unfortunately a lot of patients tend to experience, especially when they're in the process of trying to pinpoint a diagnosis or receive treatment. So medical gaslighting essentially is when patients' health concerns are minimized or not taken seriously by their doctors, making the patient question and doubt their own experiences. And patients can be made to feel like their symptoms are not a big deal or that what they're feeling is all in their head. When patients are being medically gaslit, this can have some negative consequences and effects. For example, this can lead to delayed diagnoses and treatment. And to the right, I have a quote here from an article that you can find through the NIH's National Library of Medicine. And it basically explains that rare or chronic conditions take on average 7.6 years to diagnose across both women and men in the United States of America and 5.6 years in the UK, with patients visiting an average of 8 physicians and receiving 2 to 3 misdiagnoses. So that just goes to show that delayed diagnoses and misdiagnoses are very real and very frustrating for patients. And going back to the potential consequences that can come from medical gaslighting, we also see an erosion in trust of healthcare systems, as well as negative health outcomes and an increase in distress and anxiety among patients. Next slide. So, a lack of emotional support is something that we see a lot of chronically ill youth experience, especially those who don't know anyone else with a similar condition or anyone who has experienced similar things as they have. So, for many patients, once they receive their diagnosis and treatment plan, they tend to stop receiving emotional support or check-ins from their physicians and their loved ones. Like I mentioned before, some patients never really have this emotional support in the first place. And physicians usually take the approach where, they try their best to equip patients with the tools necessary to tackle their physical symptoms, but perhaps unknowingly they leave their patients feeling unsure about and unequipped to cope with their mental and emotional symptoms. Next slide. So when young adult patients are left unequipped to handle the mental and emotional toll that comes with having a chronic illness, this can lead them to really stress about the future. They might have concerns about career planning and not having the same flexibility as healthy peers. For example, they might really have to consider whether or not a job will offer enough sick leave or paid time off, or whether or not a job will grant them the necessary accommodations they need. Will they have sufficient salary to afford treatments, or will the job provide medical benefits? So career options may feel more limited when your health is at the forefront of everything and you have to take all of these things into consideration. Um, Other things that can be challenging are socializing and maintaining relationships with others. Young adults are expected to be in the prime of their lives and have this unwavering energy. And young adult patients are more likely to feel like they're missing out on fun or exciting life experiences because of their symptoms or limitations imposed by diet restrictions, side effects from medications, exhaustion and fatigue, feelings of anxiety, depressive symptoms, and etc. Next slide. So another thing to consider is how disease progression feels simultaneously unexpected but inevitable. So flares and painful symptoms are inevitable for many, but they're hard to predict or control. Flares are hard to navigate, and it's hard to know when patients will feel better, if at all. Plus, symptoms can disrupt routines and plans and just throw everything off balance. And one of the biggest contributors to stressing about the future is the fact that chronic illness is very expensive. So copays can be expensive, and insurance companies may limit which providers patients can visit. Insurance companies can also deny treatments or procedures that they deem medically unnecessary. Prior authorization can delay treatment or cause gaps in treatment, which increases patients' risks of flaring. And for many patients in the US, there is no way to afford their treatments and medicines without insurance coverage. So, for example, if you wanted to buy a month's supply of Humira, which is one of the most common biologic treatments for autoimmune conditions, it would cost over 7,000 US dollars without insurance. Young adults with chronic illnesses are often focused they're often focused on making sure that they can afford the treatment that they need to stay alive, instead of having the flexibility to save up for other important things like a home, an automobile, retirement savings, etc. So, kind of tying all of this back to the topic of mental health, we know that many young adults face mental health challenges. And when we factor in having a chronic illness, we see that this population of young adults is left to navigate an array of both physical and mental health symptoms. And this can be especially challenging when our mental health care frameworks aren't always inclusive, understanding, or even knowledgeable about these experiences. So Rosa, you could go to the next slide, and I'll go ahead and hand it off to Akil.
Thank you, Alexis. Hello, everyone. Thank you for joining the session today. My name is Akhil, and I'm from Udupi in India. And I'll walk you through this section on the topic of accessing care from low and middle income countries. Moving on to the next slide. Okay, let's begin by looking at the scope and impact of mental health and chronic disease in India. We can have a clear picture into the challenges and opportunities through this example into the low and middle income countries. Recent research in India shows that about 1 in 7 people in India were living with mental disorder in 2017. That's almost 200 million individuals, a truly massive number. And over the past 3 decades, mental health share of India's total disease burden has nearly doubled, emphasizing that mental disorders aren't just an individual struggle, they're a major public health challenge. But what's really eye-opening is the variation seen across states and even between different population groups. For example, states that are more urbanized and developed, like Tamil Nadu and Kerala, see higher rates of depression and anxiety, sometimes linked to rapid lifestyle changes and societal pressures. Meanwhile, less developed states often have higher rates of mental illnesses that begin in childhood, such as intellectual disabilities. Now, when we look at chronic diseases like inflammatory bowel disease or IBD, the challenges of accessing care come into even sharper focus, especially for minority groups. A recent case control study found that South and Southeast Asian patients with IBD were 5 times more likely to experience PTSD symptoms compared to others. Nearly half of these Asian patients met the threshold for clinical post traumatic stress, which is staggering. And these PTSD symptoms were often tied to active disease and physical complications, which is structural factors like stigma, lack of awareness, or difficulty accessing culturally appropriate care. And as someone living with the chronic conditions such as psoriasis and IBD in a semi-urban setting, I've personally experienced the hardship of accessing meaningful mental health care, even in areas with decent physical health facilities. Services for mental health remain limited, fragmented, or hidden behind stigma. Navigating referrals, finding therapy, or even just having someone understand what I'm going through has often felt like an uphill battle. And I can only imagine how much tougher it is for people in more rural regions where both transportation and specialized services are scarce, and stigma may be even stronger. And to wrap this part, the data from India underlines the urgency for low and middle income countries to bridge the gap between mental and physical health services, and to design care that's sensitive to cultural and socioeconomic realities. Moving on to the next slide. On this slide, I want to highlight the two sets of challenges that showcase how complex this accessing comprehensive care is for people living with chronic illnesses and mental health needs in low and middle income countries. Let's look at the pie chart here. This represents the findings from a detailed review of health insurance policies in India after the mental health insurance mandate was brought in with the Mental Health Care Act of 2017. Researchers examined 235 insurance policies across 30 companies. What they found was honestly a mixed bag. Only about 38% of policies actually included explicit coverage for mental illnesses. About 51% had no coverage at all, and the rest offered partial or special coverage, often for people with disabilities. Even more concerning, the vast majority, regardless of their stated coverage, excluded outpatient care and substance use disorders. And many plans imposed extended waiting periods before mental health coverage even kicked in. So, while policies on paper have made some progress, the reality is that the coverage is patchy, restrictive, and often doesn't match what's needed by the people living with mental health conditions. Now, shifting to the right side of the slide, we have a representation of the prevalence and impact of psychiatric comorbidities in inflammatory bowel disease or IBD. According to a major review, up to 40% of IBD patients experience psychiatric conditions like depression or anxiety at some point. These issues are more common when their disease is active, but can crop up anytime. These mental health conditions don't just lower quality of life, they are connected to more frequent disease flares, higher risk of non adherence to medication, and even increased risk of surgery. Despite being so common and impactful, psychiatric needs are underdiagnosed and undertreated in IBD patients, particularly in LMICs. And the brain gut connection means emotional distress and physical symptoms are often two sides of the same coin. So when you put both these sets of data side by side, a clear gap emerges, even as we acknowledge the burden of mental health in people with chronic diseases. Insurance systems and health services just aren't keeping pace in terms of real practical support. Many people in LMICs are left with significant out-of-pocket expenses or are simply forced to go without vital psychological care. Ultimately, what we see here is the need for a big picture approach, one that recognizes psychiatric comorbidities as a critical part of managing chronic illnesses like IBD and ensures those needs are truly covered and not just in principle but in practice as well. Without that, millions remain in the lurch, navigating complex and often invisible challenges with little systemic support to lean on. Now, moving to the next slide. Yeah, here I'd like to walk you through this pyramid that lays out how we can improve access to mental health care in LMICs or low and middle income countries. Let's begin at the right at the foundational level. So we have policy reform and infrastructure development. This is the bedrock without which nothing else can stand. Think of countries introducing new mental health laws. Take for example India's Mental Health Care Act, or governments investing in new clinics, trainings, more mental health professionals, etc. But when we improve policies and build stronger health system, we are not just setting the ground for real change, but also imagine a rural district finally getting its own mental health facility so people don't have to travel hours for care. And building upon that, we have the next layer, which is integrating mental health into primary care. This simply means making mental health part of everyday healthcare, as basic as checking your blood pressure, for example. For instance, when someone goes to your local clinic for diabetes, they're also screened for depression. This not only makes mental health support more accessible, but it also makes mental health care seem normal and non-stigmatizing as treatment for any other illnesses. Next, we have the community-based approaches. Here, trained community health workers step in, especially where professional mental health staff are scarce. Take, for example, the Friendship Bench project in Zimbabwe, where grandmothers trained in basic counseling provide talk therapy on benches outside clinics right in their communities. It's low cost, culturally sensitive, and effective in reducing depression symptoms. And just above that, there are telepsychiatry initiatives which can be implemented using technology. For example, we have the Telemanas in India. Uh, Someone in a remote village can consult with a psychiatrist hundreds of kilometers away using just a phone or an internet connection. This really breaks down barriers for people who can't access specialists due to distance or costs. And finally, at the very top, it is equity in mental health care access. This is the goal we are all working towards, making sure that no matter where a person lives and how much money they have or what cultural background they come from, they can get the mental health care they need. And to sum it up, improving mental health care access isn't just about a single fix. We need strong policies, services embedded in routine care, trusted community support, and smart use of technology. When all these pieces come together, we move much closer to a world where access to mental health care is available to all. Thank you, and over to you, Malvika.
Thank you so much, Akhil. Yeah, next slide, Rosa. So when we talk about mental health care, I'm just going to touch upon certain effective mental health strategies that would really help individuals with the chronic illness. So when we talk about services, first and foremost psychotherapy. But when I talk about psychotherapy, I'm talking about trained psychologists, trained professionals who are aware of chronic illness. As a mental health professional, I understand it is not feasible for us to know about each and every chronic illness which is there out there. But even a basic understanding of what individuals with a chronic illness go through, I think goes a long way. For example, now we have this whole new field of psycho-oncology because we understand the mental health repercussions and individuals with cancer and their family, what they go through. So I think if we can just have more psychoeducation within our mental health community about chronic illnesses and the impact of it on young adults and individuals, I think that would be a long way to go to. Peer support. I will not talk much about peer support here because I'm touching more on that on the next slide. But peer support, having individuals who can understand what you go through, who are going through similar experiences as you, I think that is a huge support for individuals living with a chronic illness. Trauma informed care. As I mentioned earlier, young individuals living with a chronic illness, especially young adults, we face a lot of medical trauma. So it is essential that we are referred to professionals who are trained in trauma informed care so that we can ensure that young adults with chronic illness don't have re traumatization. Because each time we have to go to a doctor's appointment, each time we are told about hospitalization or surgery and things like that, the chance of re-traumatization is quite high. So I think having trauma-informed care is very crucial. Then when we move beyond services to education and awareness, psychoeducation, not just within the mental health community, but also within individuals living with a chronic illness, because often they're not aware of the mental health challenges that they may go through. So I think this is where our um, medical professionals and our point of contacts come in, because it is crucial that they inform and psychoeducate their patients as to what could be the potential mental health challenges. And as Akhil had mentioned, screening for common mental health challenges such as depression and anxiety, I think will go a long way so that we can curb it at the early intervention stage so that it doesn't escalate to further conditions. Awareness campaigns, I think it ties back up to psychoeducation, spreading awareness in the larger community about the mental impact of living with a chronic illness. Workshop and gatekeeper training. With the alarming high percentage of suicidal ideation and suicidal attempts within the chronic illness community, I think suicide prevention gatekeeper training for the community members is crucial so that we can identify the signs within our peers and we can give them early intervention. Early intervention is the best prevention when we talk about suicide prevention. And despite being a mental health professional, I would hesitate asking someone the suicidal question because it's been drained into our heads that if you ask about the suicide question, you are planting the idea in the head, which is a myth. So for a layperson who has no idea about this, they would not feel comfortable asking an individual if they're feeling suicidal. So that is why gatekeeper training is very important and very crucial within the chronic illness community, and policy advocacy. So until I was a part of the IBD India Patient Support Foundation, I was not aware to what extent my condition was excluded from policies because it was an invisible chronic illness. It's not considered as a disability. So I think educating patients about where they stand in terms of policy and advocating and letting them know that it's okay to speak up about it, I think is quite empowering and it's quite important. Next slide. So benefits of mental health interventions for disease management, particularly coping skills, especially when you have anxiety and stress, it can aggravate your physical conditions. So when your mental health has been taken care of and you're in therapy and you're dealing with that, automatically you would notice that your physical symptoms also seem to improve. And it also helps in self-management and self-adhering of medications. And you're usually quick to rush to the emergency department at the slightest symptom. It might not even be related to your condition. Because of anxiety, you rush to the emergency department. But with therapy, you learn to deal with them to a large extent by yourself. And you only go to the emergency department when there's really a need for it. And all of this, it improves quality of life because once your mental health is taken care of, your physical symptoms also start getting better. Automatically, your quality of life improves. You will notice a reduction in your symptoms, a reduction in hospital visits, and a reduction in sense of isolation because you are dealing with that part. You have a professional listening to you who understands you, and you have peers who are there with you. So that really helps reduce a sense of isolation, and all of this together improves your quality of life. Next slide. So I think we already touched upon this. There are a few mental health access barriers, stigma around mental health care. Despite things that are changing, there is still a long way to go, and there is still a lot of stigma that is attached with mental health. There is very limited access to mental health professionals, especially there are barely any mental health professionals who have the knowledge of chronic illnesses, especially like conditions like IBD or psoriasis. More often than not, people are aware of cancer, but not really or invisible chronic illnesses. High cost of mental health care. For individuals with chronic illness, when we are already paying so much for our physical health care, we're dealing with the cost of that. We often have to choose between that or our mental illness. Me, despite being a psychologist, I've often chosen my physical health over mental illness because there were times where I couldn't afford both. So for other individuals, of course, that is what they're going to do. And exclusion from insurance and policy. So in India, despite the mental health care of 2017, mental health is not really included in insurance policies. So, I mean, mental health care is not affordable because insurance doesn't cover it. To add to it, invisible illnesses and chronic conditions are not included in the Disability Act, which also gives us a very negative side because we don't get the benefits that other individuals would. Next slide. So what is the solution for this? If we have to come up with a solution to bridge this gap or till this gap gets bridged, right? Next slide. This is where peer support comes in. So peer support is all about individuals with shared experiences, helping each other, providing support and sharing information. Peer support is not an alternative to therapy, but peer support is that gap that can help an individual move to that stage or till they get the right treatment that they need. Peer support is all about bridging that gap. Peer support can be in many different ways. It can be one-on-one connection, online support groups or hospital-based support groups, chronic illness camps and school-based camps and things like that. So peer support is something that can be modified. It's not one size fits all. It depends on each individual on what type of peer support that they would need. Next slide. So how can peer support help? Peer support can provide mental health and psycho-emotional support mainly by reducing isolation. The moment you feel as though you're not alone and you have people who understand you, a huge burden is taken off from you, especially at the early stages of diagnosis when you will often feel you're the only one in the world going through this and nobody can understand you. But peer support really comes and really helps bridging that gap. Motivation and encouragement. Often, when you feel as though your treatment is not really suiting, you have this and you're taking too many medications, often, more often than not, especially young adults, we choose not to go ahead with the treatment because it's too much for us. We don't want to do it and nothing seems to work. But the moment you see your peer who is in the same treatment and it is benefiting them, automatically it motivates you to start adhering to your treatment. And that will definitely help in disease management. Information sharing. Your peers might have so much more information on how they're managing their conditions, their healthcare providers, the medications that they're taking, and support groups. You would know so much, you would learn so much from them that you might not find online, that you might not find from your healthcare provider. And skill building. I think it's a chronic illness community, peer support community is so wholesome because you often share skills, you share information with each other, bridging that whole gap of isolation. Next slide. See, peer support is hugely impactful, but it's quite undervalued because of the lack of funding and research. There's not a lot of research published about peer support for the chronic illness community, especially those that can be duplicated. While it is important to address these research gaps, it is very important to listen to our voices, listen to the lived experience voices, because we are the ones going through this. I think our voices will add a huge value. So thank you so much for listening to me. I'll pass it on to Rosa.
Thanks so much, Malvika. So I'm going to talk quickly about just a little bit about community-led programs, um, particularly for folks with chronic illness and youth and young adult leadership in this space. So really wanting to highlight just the impact of community programming. I think the first thing that comes to my mind in terms of this is the phrase from the disability rights movement, nothing about us without us. Really, showing the importance of having people who are most impacted by an issue really leading the solutions and how powerful that can be. Um, so wanting to, highlight community voices and needs in the spaces where folks are often left out, whether that's in support, in advocacy, in policy, really bringing young adults together through shared experience, solidarity, and change-making opportunities can allow for things like community building and validation while people are working towards a common goal, can also really help people create meaning and purpose out of the challenges that they've navigated, and provide a sense of togetherness and hope versus, feelings of isolation or hopelessness. I'm going to give a quick example of a community-led program that all of our panelists today have been involved with in different ways just to show impact. Um, uh, the example is Generation Patient, which is an organization created by and for young adults with chronic medical conditions. We do, a mix of direct support and systems level change work, so policy, leadership programming, and other advocacy initiatives. So these are just some quick examples of some of the programs that I'll talk a little bit about, but have a health policy scholars program to empower young adult patients in the US with policy, education, and advocacy opportunities. The Crohn's and Colitis Young Adults Network, which is an international fellowship to provide opportunities for young adults with IBD to learn about and engage in advocacy, and then also offer a peer support program, which are community-led spaces for young adults with chronic conditions or NCDs to really share their experiences and connect with others navigating similar issues. And we have some international groups also, which is wonderful. I'm going to, again, focus more on the impact versus the how or the specifics of these programs, but have a link to the website if you're interested in more information, or have also linked a peer support toolkit that we created that has information about some of our processes and recommendations for really starting, creating, sustaining community-led peer support groups for young adult patients. In terms of impact, using this example to show some impact and wanting to show how community can really help advocacy grow exponentially. Like what can start as one or two young adults who are wanting to share their story for change can really turn into many others doing the same, and other people, patients, creating more and more resources to educate and empower others as well. So again, just using this as the example, had one or two patients who were knowledgeable about health policy who have now trained in the last couple of years, 15 of our health policy scholars around US policy issues, and started creating resources to educate even more folks in the community. We have 50 wonderful Crohn's and Colitis Young Adults Network fellows and alumni who are in 9 different countries around the world who, have built up advocacy skills and confidence, have created over 450 articles and different videos to really empower other young adults. We have some alumni who have started their own advocacy organizations around the globe, which is really incredible, and who have been able to offer over 650 virtual peer facilitated support groups as well. So I've had hundreds of young adults from around the world again join and be able to provide support from another. So again, just showing the power of, can go from a couple of people to touching so many people. And lastly, just wanted to end with by sharing some quotes from community members about the importance of community-led programming, bringing it back to mental health and peer support, and really showing impact. This quote, "Seeking out spaces designed to support people with chronic illnesses lets me feel seen and understood without the pressure of having to inform or educate others because they've likely been through similar experiences. Connecting with others lets me share my experiences without judgment, gain valuable coping strategies, and feel less isolated knowing that people around my age are also navigating day-to-day life with chronic illness and all that encompasses." Having access to virtual peer support has helped me so much in terms of mental health. It's been a game changer, allowing me to feel more comfortable talking about experiences, and having a community that gets it has made me feel less isolated and alone. Your support has taught me what real advocacy means. I feel like I'm heard, and there are people around the globe who feel like I do in day-to-day life with chronic illness. It feels like a comfortable home to be. And lastly, never in my life did I expect to have something to be happy about in regards to IBD, my chronic illness, but now I have that. So just again, really wanting to end by showing how powerful it can be when the people who are facing a challenge are the ones leading solutions and support. And people can find, inspiration and strength and feel more hope for the future, just knowing that there are other people who understand them and who are also trying to make the world a little bit better. So I'm going to hand it back over to Malvika for just a second to chat about some resources, and then we'll start our panel discussion.
Thank you so much, Rosa. So we have just linked out all the articles that we have used for our presentation, and some resources for you guys. So you could just take a photo and look at them later on. And there is also a resource for helplines, global helplines, in case anything that we spoke today might have triggered you guys or you need help. Otherwise, this website has a resource for helplines across the world. So I really hope this helps you guys. So with this, we come to the end of our speaker segment, and now we move on to the panel discussion. So our panel discussion features Akhil and Alexis as the panelists. And if any of you guys have any questions that you would like to ask us or our panelists, please feel free to write them in the Q&A section, and we'll get to them towards the end of this segment. So to start with our panel discussion, Akhil, I would like to start with you. In your experience, how are chronic illnesses and mental health perceived in a country like India? What stigmas and barriers have you experienced in accessing care?
That's a great question, but I cannot say the same about my experience. To be honest, I wouldn't be completely wrong in saying that access to mental health care is practically non-existent in rural or semi-urban settings. But uh, in my experience too, almost 20 years of consultations with various doctors for psoriasis and almost 6 years with IBD now. I cannot recall a single instance where my mental health or the impact of my chronic illness on my mental health was part of the discussion. And this leads to a situation where you have to come forward and seek the help yourselves, and that is too big of a burden when you're already battling conditions such as IBD. And this disconnection means that mental health is rarely addressed as part of the care plan. And combining that with the cultural stigma, seeking psychological support is often seen as a weakness or shameful. And in a deeply connected society like India, where information travels at the speed of light, our families, tend to dismiss their struggles with words like, stay strong or don't overthink. Uh, but I also feel that the limited access to mental health care was also a major barrier for me. And with lack of insurance support and the financial cost on top of the chronic illness, it would be too enormous. There were also concerns regarding accessing the right care because initially, when I was getting treatment for my IBD, it was difficult to find a doctor who had the expertise, especially for IBD. And I had some uh, doubts regarding similar things in seeking mental health care as well. Whether we'll be able to find therapists who have enough experience with this. But despite all this, I think things are slowly changing now, and with greater awareness and accessibility, I hope we reach a state where we treat mental health as essential and not optional.
Yeah, rightfully said so. I think being a mental health professional in India, I do acknowledge this broken system, but I think there's a long way to go. I'm hoping the new generation of mental health professionals, we do bring that change. So, moving to you, Alexis, coming from the USA, how does stigma show up in your community, either around chronic illness or around mental health, or both? What has your experience been in terms of accessing care? And have different cultural factors played into this for you? How have cultural factors just played in?
Yeah, so I think growing up in the US, stigma around chronic illness and mental health is definitely prevalent. But it differs for everyone, I would say. Some people may come from extremely supportive families or communities, and others not so much. I know that where I'm from, in California, there are a lot of immigrants. So many people whose families come from different cultural backgrounds, they might be instilled with different perspectives about chronic illness and mental health. For example, growing up, my Hispanic family never talked about mental health. And so when I found myself in a position where I knew that I needed mental health support, I honestly didn't really know like where to start. Um, and in terms of, I think just the concept of chronic illness in general, that was also rarely talked about within my family. So when I did start experiencing symptoms, I felt like I couldn't really tell anyone because I had no idea what was happening and I didn't want people to freak out. And, I was like, I don't have an explanation for this. No one in my family has an explanation for me. So it just kind of like overcomplicated the matter. And I think that, aside from more obvious barriers to accessing care, like really high healthcare costs, I think what I realize in hindsight is that what initially served as a barrier for me to receive care was actually learned and internalized stigma around both chronic illness and mental health. And I would say it definitely took some unlearning to do of, societal stigmas. It took growth and just also listening to other people's experiences for me to get to a point where I realized that I was allowed to seek the physical and mental health care that I needed, and that, there wasn't anything shameful about it. And if anything, it was me finally being proactive about my health. So yeah.
Thank you so much for those answers, both of you. I think our next question, maybe we'll start with Alexis and then and Akil can jump in. Curious if you could um, pinpoint one change needed at the individual level, and then a change at the clinical level, and one at the policy level. So these different, Akil mentioned these different levels that were changes needed. What would those changes be for you guys?
I would say at the individual level, I would encourage people to be just confident in the fact that they're the experts of their own lived experience. And I would just really want young adult patients to feel like they can and they should ask questions about their care when it comes to both their physical and mental health. Um, at the clinical level, I would encourage physicians to just really assess their patients' perceived quality of life and inquire about their mental health, because that's a really big contributor that I just feel like doesn't get brought up often enough in a physician's office. And at the policy level, I would just encourage more research on peer support interventions, like Rosa, Malvika, both of you were talking about. That's something that I would encourage. And also just, I would encourage additional ways in which we can include chronically ill youth in mental health care conversations and frameworks.
Yeah, I agree with that. And also, I feel that, as young adults and individuals, we need to view therapy, counseling, or, emotional check-ins as part of routine self-care. And events such as these present a great opportunity for us to be open about our struggles and stories. So that is something that we can do at the individual level. And at the clinical level, I do agree that it's a bit complicated, and the healthcare ecosystem is heavily understaffed and overworked, especially in low and middle income countries. Uh, but doctors treating chronic conditions need to have some basic training in, psychological first aid, as you may refer to it, be it recognizing symptoms and offering referrals or collaborating with mental health professionals. When we as patients can put in the extra effort for the community, I think doctors can do their part too. And at the policy level, I think we need proactive measures from the government. We should not have to fight for support, and we should have policies that are, preemptive and which anticipate the needs of the people rather than responding to them.
Yeah, thank you so much, Akhil and Alexis. I think rightfully said, basic mental health first aid training for healthcare professionals is quite important, at least sensitization training or training to be more empathetic towards their patients. I think that's important. And creating a proper referral system at a clinical level where they can refer you to mental health professionals because they are your first point of contact. I think that would be supremely important as well. So thank you both for bringing that to our highlighting those points. Um, so, Akhil and Alexis, how do you think, as patient advocates, like what role can you play in this whole mental health ecosystem, maybe in terms of training or psychoeducation or helping our mental health professionals better understand chronic illness? What exactly would the role of young patients like you play into this? And Akhil, maybe you could answer that first and then Alexis.
Yes. As patients, we have one of the most vital aspects of the uh, thing is that lived experience is what we call it as, and as I had mentioned before, we find it really difficult, to find gastroenterologists who are specialized in IBD in uh, rural or semi-urban places in low and middle income countries. And because we realize the need for, specialized care. So I think similarly, even mental health professionals will need to adapt their approach to suit the needs of patients who have chronic illnesses. And we have an opportunity here to collaborate with them and act as feedback loops to offer insights and make suggestions to curate our care. And by sharing our stories, we can also help change the narrative on mental health and make it more accessible to all. And personally, after 5 long years, of uncertainty about what it means to be diagnosed with IBD, I feel that once I was part of community such as Generation Patient and IBD India, uh, I I could truly accept my diagnosis, and I'm grateful to all the people who put in the effort, to run such organizations.
I definitely agree with Akhil's point of the fact that, you know, mental health professionals should, ideally receive some sort of training and specialization in, dealing with patients who have chronic illness. But I also think that, when it comes to educating mental health professionals to better understand chronic illness, honestly, I think it just starts with simply talking about our experience in the first place. I think mental health professionals overall, they're already very familiar with topics such as, grief, anger, depression, helplessness, etc. And, these are all things that come up for chronically ill people and especially young adults. And I think that by sharing our stories and experiences with mental health professionals, I think they'd quickly realize that we deal with very similar feelings and symptoms, as other demographics that they're perhaps more used to. I think it's just, if you really think about it, it's just our circumstances that might be different or that might, require more consideration when we're talking about realistic problem solving and coping skills. So, yeah, our circumstances are a little bit different, a little more complex, but at the end of the day, it's like we still experience the same or very similar, you know, mental health challenges as any other patient that they're used to. So, yeah.
Thank you both. Yeah, these are amazing reflections. I see we have about 5 minutes left. I don't see any questions in the Q&A, but if folks have questions, feel free to put it in there. But in the meantime, maybe we'll transition to kind of our last couple questions.
Um,
I'm oh,
sorry,
yeah,
Rosa,
go ahead.
didn't mean to cut you off. I actually did have one question. I actually, for some reason, I think because I'm the host, I can't pop it in the Q&A myself. But I wondered if maybe all of you or a couple of you could reflect on from the perspective of people who might be going through similar experiences and wanting to get involved in organizations like you are all involved in, what advice you would give, whether it be in relation to chronic illness or another aspect of the broader sort of youth mental health movement. I'm just wondering if you have any sort of reflections for how people might be able to get involved in sort of, that community, I suppose.
So, just purely speaking from a personal perspective, when I was newly diagnosed with my condition, I was not aware of organizations such as Generation Patient and you know uh, cr- uh, IBD related organizations. So I went on social media. I think the power for our generation social media went searched about patient groups that were actively involved in chronic illness. That's how I found Generation Patient. So I think as especially young adults leveraging social media in this sense would really help because you can really find organizations on Instagram doing great things, getting in touch with them because I can assure that patient organizations are more than willing to help and you will never be left on read or you will never be left unanswered. So I think looking at social media organization like organizations on social media and reaching out to them personally, I think would really help. And I think Rosa would also have more to say since she's heading an entire patient advocacy organization in that sense.
Yeah, I think I would echo that, just seeing what's out there. I think I spent so many years like feeling so alone in terms of my experiences, and even just finding opportunities to connect with other patients, whether it's individually or in a peer group or through an organization, I think um, can be just so incredibly powerful. And um, I think for me, finding like Malvika said, like on social media or doing an online search of different groups that are doing advocacy work or doing meeting in other community spaces and in that kind of way, I think um yeah, is such a cool way to get involved. And personally I think that, getting involved in something like a peer group often can then lead into other, you meet people who have similar interests and are excited and passionate about making changing things in similar ways. And that can turn into, different projects together or different opportunities. So I think that that's my thought on the question. I don't know, Akil or Alexis, if you have any other thoughts. But
Yeah, I just wanted to add that I would encourage, people who are thinking about getting involved or really just seeking, peer support or a community to help them out. In general, I would just encourage them to not be afraid to reach out. I think, I know for me initially, when I was first attending peer support meetings, I was like so nervous. I was so shy. I was like, oh my gosh, like this is, kind of overwhelming. But then I quickly realized like, oh, actually, like these people understand. Like they understand, what I'm going through. They've been through it or are currently going through it too. So I think that yeah, I think I would just let people know like that you can, like be rest assured that, everyone in these communities is very welcoming. I think the goal overall is to help others, to help other people feel more empowered and yeah, and don't be afraid to reach out and build connections with other people. Because yeah, you might just learn a lot more and yeah, and make some close friends. So yeah, that's one thing I want to add.
Yeah, I'd like to recall, I think about close to 1 year ago, the deadline for the CCY and fellowship was coming up. I think it was in October, and I had not been part of any peer support groups as such before, and so I had no idea what I was getting into. But I feel that if I had not gotten into, I would have deeply regretted it. So I'm very happy that I took the leap, and I would encourage others to do the same. Finding your peers who can truly understand you can help you a lot in whatever you're dealing with. Yeah.
I love all these reflections. Oh, sorry, Lydia, go ahead. I was just
No.
gonna say I know we're out of time, but
Yeah, no, I was going to do the same, so no worries. Thank you all, by the way, for that your thoughts on that. That's really, really valuable. Do you want to close off the session, Rosa?
yeah, Malvika, do you want to go?
No, I would just like to thank all of you here for joining us today. And I think if something I would like you all to take away from this is speak up for yourself, advocate for yourself. It's okay to ask for help. And we are all examples of how lived experience has really brought us together and helped us navigate our mental and physical challenges. And I would hope that there's a long way to go here. And I would hope that there's a bigger change coming in this sector. So if there's anything you would take away from the session is just advocate for yourself, help change the narrative and help each other out, I think. Yeah. that's the whole idea of today's session. So thank you so much for everybody who has joined us, and thank you to our wonderful speakers and panelists. I think the session wouldn't have been possible without you. And thank you, Generation Mental Health, for giving us this platform on speaking on such an important topic. So thank you so much, Lydia, and the entire team of GenMH.
Thank you. No, I really, really appreciate it. And on behalf of the whole team, thank you so much for this presentation. It's been super, super insightful, and we're very, very grateful to have you. So thank you, and thank you to all of our participants as well for joining. I think it would be really, really great if you could all make the closing session in about 15 minutes time. You should have access to the links there. But again, thank you. Really, really, really great one. And we'll look forward to the closing session.